Hi, and I'm sorry that things have been so long since your last update. Um, I hope to be updating more frequently, but a lot has been going on between my personal life and whole bunch of waiting for protocols and stuff like that for the surrogacy. So, um, back in January, the end of the month, I went for screening. And in our screening, we do an ultrasound, um, basically just to make sure that everything is okay with my uterus and that I can carry the healthy baby in there. Make sure that there's no polyps, any skin growths, or anything like that. And I came back clean. I'm perfectly fine. And I'm perfectly good to go. Then I met with the doctor, and the only thing that he was concerned with was possibly being high risk again for high blood pressure. So he wanted me to go and see my family doctor to get her to sign off saying that she feels that it's okay for me to um, carry a pregnancy. So I went to go see my family doctor, and that was a bunch of back and forth between them and her and all this. But anyway, she sent me for blood work and a ultrasound on my kidneys, a 24-hour blood pressure test, and an ECG. So everything came back normal. I'm good to go. She signed off saying that it's okay to go ahead. So then I was given the update on what meds we were going to use and when we were starting meds. So I started the prenatals already just to get those started in my body and my body used to that. Um, so April 4th, we start Lupron. So Lupron is a drug. The one that they gave me is a injection. So this injection shuts off the body's normal process of hormones to egg development. It is also used to prevent premature ovulation during the ovarian stimulation process. So, in other words, what it is going to do is it's going to stop my natural um, hormone process, and it's going to stop it so that I'm not releasing an egg. So when they're putting in the transferred egg, that it's their child, not mine. Then they've also prescribed doxycycline, which is an antibiotic, to make sure that there's no infection or anything like that. Um, they also prescribe progesterone. Now, I won't start progesterone until May. And same with the doxycycline. I don't start that till May. Progesterone thickens the lining of the uterus, allows the egg to stick to the side of the lining. They also prescribe estrogen, which helps grow and maintain the uterine uterine lining, boosts blood flow to the uterus. Sorry, my notes are a little bit sloppy. I couldn't read them. And then they also prescribe a low-dose aspirin, which reduces the inflammation. So with that, we have protocol of what drugs to take. So April 4th, I will start the Lupron. April 26th is when I start the estrase. On May 9th, two things will happen. So May 9th, I go to Ontario, and I'll go the day before usually, just so that I'm not missing appointments if flights are delayed or stuff like that. So May 9th, I have an ultrasound at the clinic, and they will be checking the uterine lining to make sure that it's thick enough for transfer. I will also start the doxycycline to make sure that there's no infection. Then on the 11th is when they decrease the estrase. I will also get suppository progesterone, which was part of my last protocol as well. And I will also be doing injection progesterone, which again was normal. And then our transfer is on the 16th of May. So I'm super duper excited. I can't wait. So then after that, you have to wait 2 weeks and you go and get beta tested, which is basically blood work. So you go get blood work done, and then 2 days after, you get another set of blood work done to make sure that your HGC levels have increased. And if they've increased or doubled, tripled, whatever they're going to do, it means you're pregnant. If they've stayed the same or they've lowered, it means that it was a tubal pregnancy and you've lost the baby. So we are hoping and praying for sticky thoughts, but I am sure I will have you guys updated more. I hope to do either a live injection video for you guys so you can see me inject the Lupron, or just give you the steps of it. So that's basically what's going on right now. I am so excited. The parents are so excited. I don't know if their little one knows yet, but I'm sure when he figures out that he's going to have a sibling, he's going to be over the moon. If you guys have any questions, feel free to message me in the inbox, and I will see you in my next video. Thanks.